Welcome, welcome. We are happy that you are here and that you took time out of your busy Saturday schedule to join us for this webinar, The State of Mental Health in the Black Community, Addressing Our Trauma and Proposing Solutions. The webinar today will be led by Dr. Margaret Weaver, a licensed psychologist in the Atlanta area. Dr. Weaver will be interviewed by Dr. Flavia D'Souza, a psychiatry fellow at Georgetown University Hospital. Flavia will interview Dr. Weaver, and she will also provide further information about herself. But before Dr. D'Souza comes on, we will be opened in prayer by Nnamdi Osakwe, a PhD student in bioinformatics at North Carolina State University. This webinar is sponsored by the Black Scholars and Professionals, we call it BSAP for short, Division of InterVarsity Christian Fellowship. Our leader is Dr. Margaret Thompson. And BSAP is designed to support graduate students, professional students, and professionals and faculty of African and African-American descent. We desire that they be transformed by Christ, renewed in their academic pursuits and professional lives, and serve as change agents in their communities and in the world at large. In addition to Dr. Thompson, our team is made up of Brother Tony Warner, Dr. Alice Brown Collins, Reverend Fred Williams, Pastor Gary Hogans, Letitia Simon, and myself, Felicia Anderson. So we again welcome you to this webinar, and we will be led in prayer by Brother Osakwe.
Bow your heads. Father God, we thank you for us coming again for this web seminar, The State of Mental Health in the Black Community. Guide us, Father God, as we have riveting conversation, discussion on the challenges that we do with mental health, with those within ourselves and those around us in our community. Guide us as we learn new insight on handling our mental health challenges, Father God, with ourselves and those around us. And guide us, Father God, as we seek spiritual insight on healing from these traumas that we may be dealing with, as well as leading us to qualified individuals that can help us, guide us through this process of healing as well. Thank you for all that you do and guide us as we have a successful seminar today, Father God. In Jesus' name I pray, amen.
Amen. Amen. Yeah. Hello, everybody. I am Dr. Flavia D'Souza. I'm a child and adolescent psychiatry fellow at MedStar Georgetown University Hospital. I am also a board certified adult psychiatrist and I practice as an attending at Howard University Hospital, which is a historically Black college and university system. I also work as a DEI consultant with a company called Vision for Equity. I have the distinct pleasure of introducing our guest for our webinar today. Our guest is Dr. Margaret Weaver. Our webinar is entitled, The State of Mental Health in the Black Community, Addressing Our Trauma and Providing Solutions. Dr. Margaret Weaver is a licensed psychologist and a founding partner of Keystone Counseling Center, now LifeStance, which offers comprehensive mental health services for children, adolescents, and adults. She has also supervised and taught at the Psychological Studies Institute, which is now Richmond Graduate University, a graduate school for training in Christian counseling. Dr. Weaver has a Bachelor of Arts degree in music from George Washington University in Washington, D.C., and a Master of Arts degree in psychology from Temple University, which is in Philadelphia, as well as a Doctor of Philosophy degree in counseling psychology from Georgia State University, which is in Atlanta, Georgia. Welcome, Dr. Weaver. I've introduced you, and I'm sure other people are as curious as I am about what drew you to provide mental health services, specifically to people who identify as Christian. Talk to us about that. Why were you inclined to have Christians in mind when you started out your career as a counselor at this organization?
One of the things that I have done through the years is, of course, met with varieties of people. I met with Christians, I met with people who are Jewish, met with people who espouse Eastern religion, just met with a variety of people. And when we started our counseling center, we did not really want to restrict it to just Christians. We wanted other people to feel free to come in. But we wanted to offer services to Christians because the Christian community has been so suspicious of mental health providers, who are psychologists and psychiatrists. And so we wanted people who were Christians to feel safe, that they could feel comfortable coming to meet with a provider who would respect their value system, who understood their value system. So again, my colleagues and I, we really wanted to provide services to Christians, especially those who have been hesitant about participating in this process.
Thank you. You know, when we were talking, you said something that I found to be really striking, and I've been thinking about it since then. When the organization that you're at was acquired by LifeStance, that was one of the concerns that you all had. You know, what would it look like now that you are going to be with a more secular organization? And you mentioned something to me about Christians specifically looking for Christian therapists. Do you remember when you said that to me?
Yes, indeed.
Yeah. And I was struck because you said it's now seeming that it's something that's attractive because people are really looking for someone with like beliefs.
That is correct. One of the things that we realized as we were going through this process, when LifeStance was buying us out, we went into this thinking that being Christian counselors might actually work to our disadvantage. And in the process, one of the things that we discovered was that it actually worked to our advantage. I think one of the things that's happened over the years, insurance companies have recognized that there's a need for Christian counseling. As a matter of fact, for people who are providers and trying to get on with insurance companies, one of the specialty areas now is called Christian counseling. And I believe that's because people have called in to the insurance companies and wanted to meet with the provider, but making it very clear that they wanted that person to be a Christian. And so again, what we found out as we went through the buyout process was that the fact that we were Christians actually worked to our advantage.
Mm-hmm, mm-hmm. Can you comment on the difference between a Christian counselor and a counselor who identifies as Christian?
Yeah, I think that's a very important distinction. There are Christians who are psychiatrists, who are psychologists, who are counselors, and really they don't necessarily integrate their Christianity or their Christian beliefs with what they do in the therapy session. And so that's what we mean when we say there are Christians who are counselors, and there are Christian counselors. And I think the difference is that a Christian counselor does try to integrate their belief system, their Christian beliefs, with what they do in the actual therapy session.
Mm-hmm. Mm-hmm. Thank you. So, like I said before, the title of the webinar is State of Mental Health in the Black Community, Addressing Our Trauma and Providing Solutions. whenever I do these kinds of educational events, I like to make sure that we're all on the same page, that there's the same level of literacy. And so I'd love you to start by discussing trauma. What do you understand trauma to mean? What does it look like? How do you think about it?
Very simply, trauma is an emotional response to a terrible event. A terrible event like a car accident or being the victim of a crime, rape. Those are just some examples. Being involved in a natural disaster. Those are just some examples of trauma. Now, there is what we might call acute trauma. And that just means that a person has experienced an event, just one event that was traumatizing. They were raped or they were robbed, just one event. But there's also what we call more complex trauma. And that's when it's not simply one event, but ongoing events. And that's with people, for example, who are experiencing domestic violence, and they experience it every day. And so there's a distinction there between just having one event and then those who are experiencing traumatic events on an ongoing kind of basis. Then we have what we call intergenerational trauma. And when we speak of intergenerational trauma, I guess a good example of that would be what happened to Black people starting with slavery. Slavery had an obviously incredible impact on us as a people. And there's certain things that came out of slavery that have impacted us through the generations. And so we have different types of trauma. It's not just one type. There's the kind of a simple acute traumatic event. And then we have intergenerational trauma.
Now, you mentioned that trauma is an emotional response. How have you seen it impact people physically, emotionally, psychologically, and/or spiritually? What have you seen in your practice?
Well, it is an emotional response to a terrible event, but it has all kinds of ramifications. And so when someone has been traumatized, they might have recurring memories of the event, recurring intrusive memories of the event. They might have flashbacks. They might find themselves having dreams and nightmares. They may avoid situations or people or places that remind them of the traumatic experience. People might have angry outbursts and be irritable, hypervigilant, having sleep disturbance. So it can manifest in varieties of ways. But also, of course, physically, there are times when that headache that someone can't explain, or even sometimes chest pains, actually might have its root in a traumatic experience. Spiritually, yes, I really do believe that when we're traumatized, it can impact us spiritually, no question about that. I think one of the examples of that in the Bible is 1 Kings 19 with the prophet Elijah. And what we discover, Elijah and on Mount Carmel was on top of things, and God used him mightily and did wonderful things. But then in 1 Kings 19, Jezebel sends word to the prophet that she's going to kill him. And so this great prophet of God, when he hears that Jezebel is going to kill him, he basically just loses it. He tells God, it is enough. I'm done. And he even asks God to take his life. And so I think we see here an example of what a traumatic experience can do. Now, there is what we call a direct impact that, let's say the person who's actually been robbed. That's one type of trauma. But then you can also be traumatized when you witness someone experiencing a horrible event in their lives. We can be traumatized if somebody tells us about a good friend or family member that has had a horrible experience. And again, with Elijah, Jezebel was not there, but she sent a threat. And that threat was so traumatizing that he didn't want to be a prophet anymore. And as we look at that chapter, God nurtured him and provided a healing experience for him.
That's a really wonderful example. Thank you for utilizing that. Oftentimes, if we don't have an eye to see these examples in scripture, we might just pass over it and not appreciate what God is trying to tell us about the human condition and about what we might need for our own healing and well-being. So I appreciate that. What are some of the traumas that you think are unique to the Black community living in the United States?
Well, certainly we have had to experience racism. We've experienced discrimination. And I do believe that what happened in slavery does impact us even now. I believe that slavery was a traumatic experience, not only for our ancestors, but I believe it is something that has continued to impact us. For example, I do believe that many African Americans struggle with feelings of worthlessness, feelings of powerlessness. And I do believe that some of that is rooted in what happened in slavery, what happened in Jim Crow during the time of segregation. And so I do believe that we have been impacted in just so many ways. Feelings of worthlessness, powerlessness, low self-esteem. I also think that we have, to some degree, internalized some of the things that have happened to us even from slavery. For example, colorism. You know, we don't talk a lot about colorism, but it is alive and well in the Black community, not just in the United States, in general, the Black community. Colorism, where there's discrimination based on the color of a person's skin. And so what happened, and I think this is also rooted in slavery, when the slave masters took advantage and raped the slave women, the children that came out of that were sometimes treated very different. They were allowed to come to the big house, and they were treated in some ways that was just different. And I think there's lingering after effects of that even now. And so we don't talk much about it, but it is still here. And the general way that it goes, of course, is the lighter that you are, the better that you are. And so that whole issue of colorism is, I think, a part of what has happened through the years and what happened even in slavery. And not just with the color of the skin, but even with features. That through the years, I think what we've seen, even within our own race, we've seen where the more your features resembled white people, you were considered prettier. You were pretty, you're beautiful. And if your features were more like, let's say, African features, then you were considered ugly. And so we see the effects of trauma. We see the effects of slavery and this intergenerational trauma. It just affects us in so many ways.
Can you talk about the pandemic and its effect on our community?
Yes, the pandemic, I believe, has had a terrible impact on the Black community. Well, first of all, disproportionately, we died more. We were impacted health-wise more. We've been impacted with job loss, homelessness, and we've just been impacted by the pandemic in just so many ways. But I think it's also important to keep in mind that when we have a crisis or trauma like the pandemic, it is a crisis. But for we as believers, we know that at every crisis, we need to look for the opportunity. That if there's a crisis, that we also need to look for the opportunity. One of the things that has happened because of the pandemic is many pastors of Black churches have just been bombarded by parishioners who are having mental health struggles. They've just been bombarded. And so the kind of good thing about that is that it's bringing about a heightened awareness of the need for us to do something and for the church to do something about mental health issues in the Black community. And so, as I mentioned earlier, the pandemic.
Can I just pause you there for a second? For everybody who's listening, can you just type in the chat room, look for the opportunity? Can I just see everybody type in the chat room, look for the opportunity? I like that you said that, Dr. Weaver. It's been a difficult time. Go ahead.
Yes, I really do think that it's important for us in the crisis to look for the opportunity. And what I see happening now is many pastors. I just did a workshop a few weeks ago for a group of pastors. These pastors have a retreat every year. And this year, they wanted someone to come in and talk about mental health in the Black church because of what has happened with the pandemic. And so I do think that there are opportunities now. I've done a number of Zooms and workshops like this since the pandemic because everybody is aware and seems to be even more aware of the fact that we have some mental health issues in the Black community that need to be addressed. Now, one of the other things that has happened, which I think is very, very positive, as a community, we've been very suspicious of mental health providers. We've been very, very suspicious. And we have not always been comfortable meeting with a mental health provider. Number one, because we have believed that somehow if we met with a mental health provider, it meant we didn't have enough faith, or it meant that we did not pray enough. So that's been one of the things that's gotten in the way, especially with Christians, that, why should I meet with someone? If I can pray my way through, or I should have enough faith. I remember a pastor here, we were going to be participating in a mental health conference at his church. And as a preliminary to that, he did a brief little YouTube speaking to his congregation about the importance of addressing mental health issues. And one of the things that he said was that he had a parishioner who, after a service, came up to him and said, well, Pastor, I have a relative in another state, and she had a mental breakdown. And so this pastor said, well, I sure hope you got her some help. And the member said, oh, no, we're going to pray her through. And the pastor said, now she's telling me they're going to pray her through, but she's standing in front of me with her glasses on. And the point being, of course, that she would go to a doctor to get help for her eyes, but they're going to pray the relative through. And I think it's just important for us to know that we can have Jesus and a therapist. We can have Jesus and a psychiatrist. We can have Jesus and a psychologist. And that it doesn't have to be one or the other. Again, sometimes people are reluctant to meet with a provider because they're not sure that they will be understood. They're not sure that the person will get them. And that's why cultural competence is so very, very important. And that's why providers need to really make sure that they understand the culture of the person that they're meeting with. There are, of course, those in our community who won't meet with a provider because they see therapy as something for rich white people or celebrity types.
Mhm.
That's just how they see it. Or they see it as something for crazy Black people. And so there's been that stigma that we've had to deal with. And again, that's why I think it's important for us to have workshops like this where we're actually educating people and letting them know what therapy is about, what they can expect, and to destigmatize meeting with the therapist. Now, another way that the pandemic has helped.
I'm gonna pause you there because I'm having a good time with myself here in the chat. You said, people think that celebrities, psychiatrists are for celebrities, and I said celebrity. We're all celebrities through Jesus. And I want people to. One of the things I wanted to echo, I want to do a little call and response here, is we can have Jesus and a therapist. We can have Jesus and a psychiatrist. I don't want to spend too much time talking. If somebody could just put that in the chat for me, we can have Jesus and a therapist, we can have Jesus and a psychiatrist. I do want to say, because you talk about the glasses, one of the articles that I was reading recently was actually talking about how untreated depression can cause structural changes to the brain. I'm going to repeat that. So it's the same as if you have an untreated medical issue, and that those structural changes can be reversed with medication treatment. So I just wanted to illustrate that there are many, many examples like this. This is why I'm in psychiatry, where we see that medication really makes a difference structurally. It's not just about what a person is feeling or thinking. There are also things that we can't see with our eyes that are happening to the individual. Go on, Dr. Weaver.
Yeah, but let me just kind of piggyback on that. As you mentioned that, it reminded me of an experience I had with a client who I felt could be helped with therapy, but the more I met with him, I realized he also needed medication. Well, he was okay about therapy, but he was resistant to getting medication. And so one of the things that we sometimes find is that people who come in for therapy, they say, well, I'll do that, but I'm not going to do the medication. Well, after a period of time, I did convince this a young man to meet with a psychiatrist and to get therapy. And after he had been on the medication for some weeks, he came into the session, and one of the things he said to me was, is this how people feel all the time? And what he was saying in essence was he was depressed, but he was functional. He could go to work. He could take care of his activities of daily living. But he just thought that it was just his personality, that he felt down all the time because that was just his personality. And it was not until he got on medication that he realized that he could actually feel good, that he didn't have to feel depressed like that. And so, yes, I think it is important for people to recognize that even talking about depression, people can be depressed because of situations. They lost their job, having marital difficulties, but there are also people who are depressed because of chemical factors, because of you look back in their family has a history of depression. And so that's why it is also important for people to be open to getting on medication.
Thank you, Dr. Weaver. The other thing that I wanted us to just kind of talk about with the new Anti-Lynching Act, the Emmett Till Anti-Lynching Act, you had mentioned in our private conversations how the murder of George Floyd may have affected the Black community. And if you could put a few words to that, that would be really helpful too.
One of the ways that we could be traumatized is by being exposed to aversive kinds of images repeatedly. And so I do think that we have been impacted by seeing certain things over and over and over again. Now, we need to see these things. We need to know about these things. And thank God there are people who are making videos. Thank God for that. But I do believe that, at least with some people that I've met with, seeing those images over and over and over and over again has created some depression and forms of traumatization. So yes, we do need to see what happened with George Floyd. We need to hear about it. We need to see it. But some of us need to be careful because if we see too much, some people see too much, it can create depression. And so again, while we need to see those images, people need to also be able to monitor themselves and to know exactly how much they can handle. And similar situation, although it's not related to George Floyd, but with veterans that I've met with who have been to Iraq and the like, they're having some difficulty with some of the images that we're seeing now with all the things that Russia is doing. And so we have to be able to do some self-monitoring.
Thank you very much. I know that you started to, actually, I wanted to make a comment on that because people ask me how I do my work. And I actually am pretty avoidant about watching too much graphic stuff on the news personally. And I also like to watch really very light, kind of silly comedy. So I like to watch like pranks that involve like people that are consenting, that enjoy it themselves, maybe like 1-2 minute things. And that helps to lighten my mood. And then I kind of try to lean into my community as much as I am able to. I know that you touched on this before, but how have these kind of chronic complex traumas impacted the mental health of the Black community as a whole?
Well, I do believe that in terms of how it has impacted us as a whole, when you look at slavery, again, slavery impacts us individually, but it does impact us also as a community. I think one of the struggles that we have often had in the Black community is coming together as a community. I believe some of that has its roots in slavery. Because one of the things that the slave master would try to do is create as much division as possible among the slaves. The slave master would do everything that they could to create disunity among the slaves. And I do think that as a community, we have had to deal with that issue. There are times when we haven't been able to come together, the times when we have not trusted each other. And I do see that as a part of what has happened as a result of the trauma of slavery.
Thank you. We have a few minutes remaining in our dialogue here. And so what I want to do is to shift a little bit into a space where we think about some of the solutions, maybe even for those who have not engaged in their own treatment. If you could illuminate or give us a flavor of what might happen in one session with someone who's coming in with some of these trauma symptoms.
Okay. Well, let me mention one other thing that with regard to the pandemic that
Sure.
I see is advantageous at this point, and that's what we call telehealth.
Mm-hmm.
As a result of the pandemic, many providers, and I know a lot of psychiatrists and a lot of psychologists are now meeting with people via telehealth. And so instead of having to come into the office, they can meet one-to-one with their therapist. And of course, the advantage of that for some people is people are squeamish about coming into the office and seeing somebody that they know and all of that. Well, that the telehealth kind of takes care of that. And so I do believe that that is one of the clear advantages that we do have coming out of the pandemic. So one of the questions that people do have is, okay, let's suppose I decide that I want to meet with a psychiatrist, or I decide I want to meet with a psychologist. What is going to happen? I'm having extreme anxiety and I don't know what to do about that. So what's going to happen when I walk into that office, especially the first time, what's going to happen? Well, in all likelihood, when you walk into the office for the first time, you would fill out some forms indicating the issues that you're dealing with. And let's suppose that the issue is anxiety. The person, the therapist, the psychiatrist is going to try and find out, what's triggering it and trying to find out what's keeping the anxiety going. And if it's determined, for example, that the person is engaging in a lot of negative self-talk, they're kind of talking themselves into anxiety. They're rehearsing things that are very, very negative. And if it's determined that this person is really suffering from a lot of negative self-talk, if you are, for example, a cognitive behavioral therapist, you're going to try and work with that person and help them to change their thinking. In the belief that if you can change their thinking, you could also change, it will change the way that they feel. And so if a person is coming in with anxiety, you try to determine what those the negative self-talk is all about. You try to get them to look at things a little differently, from a different perspective. For example, if someone is a believer and they're very anxious, well, we can talk about the importance of changing the way you think. Philippians 4 talks about changing the way you think and thinking on things that are true, honest, just, lovely, good report. And so what you do is you start working on things. Again, if it's anxiety that's going on, working with mindfulness, meditation. Mindfulness just simply means getting the person to stay in the present. Stay in the present and not get so focused on the things that have happened in the past, trying to stay in the present. So you work on that. You might also work with meditation, teaching people how to meditate, breathing exercises. Those are some of the things that we do. Richard Foster, his book, The Celebration of Discipline, says that one of the things, unfortunately, we as Christians have done is we've seemed to have decided that meditation is an Eastern religion thing, and so we don't want to have anything to do with it. And that's really unfortunate because the Bible over and over again talks about meditation. And so working with people and helping them learning how to meditate, again, that's one of the tools. Sometimes people need to learn how to reframe their experience. They're looking at it one way, and the way that they're looking at it is contributing to the anxiety or contributing to the depression. So one of the things that you try to help people to do is, let's see if we can look at this from a different perspective and to reframe the experience. And again, of course, obviously, there's a whole lot more involved in that, but that's just kind of a flavor of what would happen in a session.
Thank you so much, Dr. Weaver, for sharing your expertise with us.